Okay, so at the distal end of the upper limb, we can look and work on the hand a little bit and the wrist. In the wrist region, there's actually a lot more surface anatomy than you might think. You can find the distal ends of the radius and the distal end of the ulna. The radius is more anterior at its styloid process, and the ulna is more posterior. And if you sort of have a finger on both of them, they're not exactly at the same location. The radius tends to be a little more distal on the limb than the ulna in terms of where it ends. And that makes sense, at least to me as an anatomist, since the radius is really the primary bone that articulates with the wrist bones. The ulna doesn't really articulate with that much. Some of the tendons in the wrist you can find. You can usually find the Flexor Carpi Radialis and Flexor Carpi Ulnaris tendons. Can you just kind of like flex and extend your wrist kind of back and forth a little bit? Like right in here, there's going to be a tendon here that's the Flexor Carpi Radialis, and then one over on this side that's the Flexor Carpi Ulnaris. And those, on each side, those are two strong wrist flexors. There is another wrist flexor that some of you have and some of you don't, called Palmaris Longus, and that one's just medial to the Flexor Carpi Radialis.
He's totally got it.
He's got both. Yep, I can feel one here and one here, so you do have that. Then we can also find some pulses in your wrist. If you go just lateral to the Flexor Carpi Radialis, you should feel that really prominent radial pulse. And then if you go over on this side in between Palmaris Longus and Flexor Carpi Ulnaris, that's where you can find the ulnar pulse. And it's not as strong because it's kind of stuffed down there underneath that muscle, so it's harder to get to. But if you are sort of targeted, you can definitely feel it down in that space. Yep, there it is. Feels weaker than this one. Within the hand, there's just a couple things I wanted to show you. The position of the heads of the metacarpals. They are kind of right about here where you have these, people usually have calluses or pads on in their hands. That's going to be about the location of the metacarpal heads. And if you just sort of feel around there and move the person's finger around, you can kind of feel that joint in there. And I just wanted to point out that it's not at the same place as this crease. This crease right here is called the flexion crease. That's not the position of the joint. The proximal IP joint is right at about the position of the flexion crease. Again, if you kind of flex his finger while you've got your finger on there, you can kind of approximate where about that joint is.
Right.
And then the distal IP joint is actually just a little bit further down than the distal flexion crease. So of these three creases, only one of them is actually at the position of the joint. And it's just kind of the way the skin stacks up that creates those creases.
Most people's flexors are so tight that it can actually make their elbows uncomfortable. Or I'm kind of convinced that if you can, again, loosen these flexor muscles up, what it does is it makes space for these bones to move around. So I consider it arthritis prevention.
Sure.
And people who have arthritis in their hands, and I have many clients who have arthritis in many parts of their body, and that's why they come to me, is because we can actually, by lengthening these muscles out and helping them be flexible, as well as strong, we can make space in the joints for more comfortable movement, even if there's some additional bone there, and definitely make space for the transference of like lymph fluid and synovial fluid and that kind of stuff, so that the inflammation that's in there can move out of there. And lots of times after a person's first good arm massage, the lymph nodes in their axillary region will swell in response, because they're getting some of that metabolic waste or whatever it is that causes the inflammation out of there. So yeah, so I would be working these muscles. I can push them. If you push a muscle towards center a little bit, it has the effect of helping it loosen for some reason. I think of it like those Japanese finger cuffs, where you have to push towards center to get them to loosen up enough to get a finger out. So, so that is a lot of what I'll be doing in these flexor muscles. And then just helping the tendons of the hand experience the length that we've created. Sometimes tendons don't slide as easily in their sheaths as you want them to, and you will know that because after you loosen all of this up and you start running your knuckles through the tendons of the hand and the fingers, people will feel tenderness and like pulls. And so then you will want to really soften and move all of those carpals and metacarpals and phalanges around a lot.
It's kind of like how when you were doing the foot, you were letting the bones do the massage for you.
Exactly. Exactly. So, and most people really like to have this hand extended. So I'm kind of grabbing the palm. How can I show you this? And just spreading it out.